All right, we are officially recording. Good evening and welcome, Glendale Unified School District and our community. My name is Oscar Macias and I'm the Director of Equity, Access, and Family Engagement. I want to start off by thanking you all for being here tonight. Before we begin, I would like to get our interpretation feature going. I will ask our interpreters to introduce themselves and give directions on how to use and access the interpretation feature. So let's begin with our Armenian translator, please.
Thank you. Բարի երեկո հարգելի մասնակիցներ, շնորհակալություն, որ մասնակցում եք այսօրվա մեր վեբինարին։ Եթե ուզում եք այսօրվա ժողովը լսել հայերենով, խնդրում եմ ձեր էկրանի ներքևում գտնվող փոքրիկ գլոբուսի նշանի վրա սեղմել եւ ընտրել հայերենը, Armenian-ը, որպեսզի ինձ լսեք հայերենով ժողովի ընթացքում։ Շնորհակալություն. Thank you.
Thank you. And for our Spanish translator, please introduce yourself and share your feature, please.
Buenas tardes a todos los presentes. Mi nombre es Verónica Jenks y voy a estar dando la presentación en el idioma español. Para poder acceder al canal en español, por favor, fíjense a la parte de abajo de la pantalla, donde va a haber un círculo, que es como un globo terráqueo, donde van a poder seleccionar, presionando ese botón, el canal en español para recibir la traducción en español de toda la presentación que se lleva a cabo esta tarde. Muchas gracias.
Okay, and with that, I will begin our translation feature officially now. All right, let me get our slides going. And we are ready to begin. Good evening, and thank you again for being here in attendance to be a part of Glendale Unified's Parent and Community Conversation for LCAP. Today is Tuesday, December 5th, 2023. The topic for our conversation tonight is student wellness. Before we begin our conversation, I want to extend my gratitude to our Board of Education for their governance, our superintendent for her guidance and leadership, and the entire Glendale Unified community of teachers, support staff, school and district administrators, parents, and especially our students. So tonight, we are very much having a conversation not only about our LCAP, but everything is about how we're situated and organized. And it begins with our Board of Education priorities. And on the screen, you see the four that we have: maximizing student achievement, fostering a positive culture of learning, ensuring the health and safety of students and employees, and maintaining district financial responsibility. Our conversation tonight will focus on fostering a positive culture of learning and ensuring the health and safety of students and employees. Within that as well, you'll see a close alignment with our LCAP goals for this 23-24 school year. We have three: maximizing student achievement, fostering a positive culture of learning, and ensuring the health and safety of students and employees. So you see the complete connection and alignment between our Board of Education priorities and our LCAP goals. Tonight, we are going to have a conversation about student wellness, and we have three lovely presenters and amazing presenters representing our student wellness department, and I want to open it up the floor to our first presenter, Ms. Amarians.
Good afternoon, everyone. My name is Lerna Amarians, and I'm one of the homeless and foster youth counselors here at the Student Wellness Services Department. And today I'm going to share with you some of the services and resources that we provide to our students and families. So services provided for our unhoused and foster youth students and families. GUSD Student Wellness Services coordinates programs for students experiencing homelessness and students in the foster system. GUSD currently supports 57 unhoused students and 57 foster students in the 2023-2024 academic year. Additionally, 1,174 families who are living with another party are also offered support as needed. Next, please. Services provided for our qualifying families are immediate school enrollment in free and reduced lunch, access to the food pantry in our Student Wellness Services Department, mental health counseling, referrals to tutoring, medical, dental, and vision referrals, parenting classes, transportation, housing and shelter referrals, shoes and clothing, school uniforms, school supplies and backpacks. We also offer hygiene products and kits, gift cards, holiday food baskets, holiday toy drives, as well as holiday warm meals, assistance with immediate access to technology, case management and coordination of services, and youth employment through GYA and the City of Glendale. Thank you.
Hi, everyone. My name is Tamar Kalfayan, and I am a licensed marriage and family therapist and a clinical supervisor for the Student Wellness Services Department. I'm going to go over some of the current needs for mental health services for the 2023 and 2024 academic year. Since the beginning of the school year, the GUSD Student Wellness Services Department has received over 445 referrals to support students with mental health. Referrals are received from parents, school administrators, counselors, school psychologists, nurses, other district departments, community agencies, and self-referrals. An additional 371 students who have IEPs with mental health goals and services are supported by psychological service providers from the education department. Next slide. So an update on the risk assessment. Total number of threat assessments since the beginning of the 2023-24 school year. We have had 144 total number of risk assessments. Out of the 144, 49 assessments of secondary students, so middle school and high school, 95 assessments of primary students. 10 students were hospitalized for further evaluation and care. And then here is a chart that shows the number of threat assessments and the number of students hospitalized, showing the current year 2023-24 as of 11/8/23. And then we go down to last year, 2022 to 2023. So 31 threat assessments, and out of those, 42 were hospitalized. In 2021-2022, we had 270, so a decrease, and number of students is 41. And then 2021 partial year, we had 94 threat assessments with 26 students hospitalized. 2019-2020, we had 190 threat assessments and 31 students hospitalized. And in 2018-2019, we had 288 threat assessments, and out of those, we had 86 students that were hospitalized. Next slide. So mental health services provided for the 2023-2024 academic year. GUSD offers a range of mental health services that provide effective interventions to stabilize the student's social and emotional functioning to help them succeed academically. Counseling services are provided by 18 psychological services providers and 7 interns. The services that our department offers is individual counseling, which is targeted one-on-one intervention addressing specific counseling goals based on individual needs, typically for a duration of 12 sessions. We offer group counseling, which is targeted intervention provided to a group of students addressing social skills, anger management, behavior, and academic motivation with a duration of 6 to 8 weeks. We also offer family training and workshops. We cover various topics relating to mental health awareness and parenting skills. We have classroom lessons. These lessons are presented from the second step curriculum on growth mindset and goal setting, emotion management, empathy, kindness, and problem solving. And we also provide crisis intervention, which is available for crisis intervention counseling and risk assessments. Next slide. So the district has also partnered up with Hazel Health, a whole child student wellness, mental health services that are offered at school and at home. Hazel Health is through the Los Angeles County of Education. It's contracted therapy services, and this is available to provide telehealth opportunities for students. Parents, guardians are able to make referrals, and parent and guardian's permission is required to join these services. Currently, there are 61 students receiving Hazel Health services, and out of those 61 students, 94% of these students access Hazel Health services from home. Next slide.
Good evening. My name is Kanar Kakechan. I'm a licensed clinical social worker and one of the other clinical supervisors with the Student Wellness Services Department. I'm going to continue on from where Tamar left off. So all of our schools have crisis team members in the event that a crisis were to arise with a student. We conduct threat assessments for students who are at risk of threat to themselves or threat to others. Of these crisis team members, we have school administrators, school psychologists, school counselors, our psychological services providers, our school resource officers, and teacher specialists who are all involved in the team and communicate together to make sure that our students are receiving the support that they need to remain safe. Next slide, please. Some of the follow-up care that we do following a threat assessment is to safety plan. We have re-entry meetings and plans for students who are hospitalized and are returning back to school. We have student support team meetings, in-person telehealth counseling support. A lot of our students get referred to counseling if they were to go through a threat assessment, and we offer that services to them. And then we can also link with outside resources and referrals to community-based agencies that we work with. Next slide, please. In January, we are beginning a curriculum called Bridge to Belonging, and this is to welcome some of our newly immigrated students. The Student Wellness Department has created this curriculum to be used in 8 sessions and is designed to support the integration of newly immigrated students. We'll be teaching them effective emotional management and cultural adaptation strategies, helping them process the emotions associated with their immigration journey, help them develop an understanding of the process of acculturation, inform them about key differences in the US public school system versus their home country, and then teaching them coping strategies to more effectively manage their emotions, all while building resilience. Next slide, please. Some of our schools have wellness centers. Currently, all of our GUSD high schools and middle schools do have wellness centers, and they provide students a calm, supportive environment in which they can focus on their social emotional well-being. Edison, Glen Oaks, and other elementary schools are also opening wellness spaces, which has been pretty helpful for some of our students to utilize. Next slide, please. Some of the support from our community partners, we have partnered with the Glendale Police Department and have resumed the Teen and Police Partnership, our TAP program, for some of our secondary students and parent guardians who meet together with a team of student wellness services staff, our GPD officers, and a GPD social worker for about 6 weeks with this program. Student Wellness Services also collaborates with Pacific Clinics and D.D. Hirsch Mental Health Services to link our families to additional mental health resources in the community and supports as needed. Next slide.
Thank you so much. And I want to share now what we've covered so far this academic school year for the 23-24 school year is specifics to LCAP. We have had presentations and conversations, webinars that covered student achievement, school safety. Tonight, we're covering mental health. In January of the new year, college and career success. Then we cover budget. In April, physical health and wellness. And then hopefully at that point, we will have a lot of information, a lot of feedback from our community and our school sites and everyone involved in our process that we will be sharing the new LCAP draft. From a board meeting perspective, you see the timeline there. There will be a mid-year update report on this current LCAP with hopefully a new presentation of the next LCAP that'll be drafted as a public hearing in June. And on June 25th, formal adoption. This is where the importance of your viewing this video right now, whether you're watching it live or later, we need your feedback. And we have partnered with a corporation called Thought Exchange. This goes a little bit more beyond a normal survey, SurveyMonkey, Google Form, whatever it may be. On screen, you see an OCR code or a website, tejoin.com. What we're asking you to do is give us feedback with a specific question in mind. It's on screen and I will read it right now. What resources have been helpful and what more can the district do to further support students' mental health? So if you go and follow the instructions, and it's very simple to use, it is very important that you do provide us that feedback. It does help us correspond and correlate to our series of plans and actions, again, driven by our Board of Education priorities that'll help us form out our LCAP goals and our actions and dollars assigned to that. So again, Please participate. What is unique about Thought Exchange, it allows you to go into the system and rate other people's comments and feedback that you may not have seen yourself. Again, it allows us this invaluable amount of feedback that will help us formulate our next LCAP. Today's webinar, it is being recorded. It will be posted on the Glendale Unified School District website. It'll give community members more opportunities to view it and also to give input. That Thought Exchange will be open for a long time, actually, because we want to make sure that our principals will share this with their school sites and share results, share with their meetings, share the information when it comes to student wellness, and they will also be soliciting input for the formation of their school plans for student achievement. If there are any questions, my email is listed here. But beyond, I want to thank everyone for being in attendance. I want to thank our presenters that represented our Student Wellness Department. I want to thank our translators for helping out and supporting this process. And I also want to thank our friends from the Educational Technology and Information Services Department for their support behind the scenes. And thank you to the community of Glendale Unified and all our families, and especially our students. And with that, I want to say, stop sharing real quickly. A good night to everyone, and thank you again. Have a wonderful evening.